Sure. As you said, I'm the Director of the Office of Special Health Affairs, but with regard to the Maternal Infant Early Childhood Home Visiting Program, I am currently the Acting Director of a new division in the Maternal Child Health Bureau called the Division of Home Visiting and Early Childhood Systems. We recognize that, that home visiting is an intervention that could have great benefit to at-risk families, and in recognition of how large the program is and how important of a program that it is, we created a new division. So I'm actually acting director of that division too. There are a number of challenges and opportunities with this program. Probably the first challenge that I would say we're having with this program is that when it was implemented, we basically had to drive the car as we were building it. There were a lot of things that needed to be set up in order to ensure success of the program. There are a lot of moving parts to this program, a lot of requirements set in the legislation that I think we're only just now beginning to get a really good handle on. States have been very busy setting up their programs. Some have begun providing home visiting services to their at-risk families. So I think probably the biggest challenge has been in the implementation, setting up a new large program. But I will say there are probably more opportunities than there have been challenges. This is an opportunity for maternal child health to begin to look at evidence-based policy initiatives such as this program, to set up information and data systems in order to demonstrate improvements in those areas that are priorities for our state grantees. I see this also, and more importantly, as a way for, on the federal level as well as on the state and local community level, to develop relationships with those partners that may not have always been natural partners. So for example, home visiting is, most states run through the Title V maternal child health program, and this program would then perhaps push states to develop relationships, for example, with their education agencies, with their Medicaid agencies, and so on, because there's so many different areas that the home visiting program asks for improvements, improvement in economic self-sufficiency, in coordination of services, in addition to improvements in maternal and infant health. So that really takes a lot of partners and a lot of different fields and disciplines to ensure success of this program. So I see that as probably the biggest opportunity.